For people living with type 1 diabetes, tight glucose levels are really important because they dramatically reduce the risk of complications affecting the eyes, the nerves and the kidneys. The artificial pancreas offers great promise for patients with diabetes, but researchers are still in the process of gathering evidence through trials. Researchers like Helen Murphy at the University of East Anglia.
So the importance of tight glucose levels is well established, but actually the realities of how to achieve it are really quite challenging. So for those of us with a normal functioning pancreas, our bodies are making insulin and adjusting that insulin really every 5 to 10 minutes. Whereas for people with diabetes, they're having to inject insulin. They might do that 3 or 5 times a day, but it's really difficult to mimic what the normal functioning pancreas does. So really people living with type 1 diabetes almost need to be expert nutritionists. They need to understand exactly how much carbohydrates in their food, and then they need to be mathematical geniuses to match the insulin dose very precisely to the amount of carbohydrates that they eat. So the real difference between the conventional insulin delivery that's delivered by injections or by an insulin pump compared to the artificial pancreas is that the artificial pancreas is able to deliver small amounts of insulin, little and often. So it's mimicking a normal functioning pancreas in that way, if you like, because it's adjusting insulin every 10 to 12 minutes, including during the overnight when people are asleep. So the artificial pancreas has got 3 components: a continuous glucose monitor, an insulin pump and a mathematical algorithm that links the insulin pump delivery to the real-time glucose levels. Over the last decade, the advance in continuous glucose monitoring has meant that we've been able to start some high-quality research studies into the artificial pancreas across a whole range of different patient groups. So the early studies for the artificial pancreas have been conducted in children as young as 1 and right up to adults in the age of 80. Now the group that I work with in particular are pregnant women. So we've been really delighted to be able to work together with bioengineers and bring the latest artificial pancreas developments to this important patient population.
Helen has been running a trial of a newly developed closed-loop artificial pancreas system at her local hospital with pregnant women with diabetes. The trial's ongoing, but she spoke to one of the trial participants, specialist midwife Nina Willer, to hear how it had affected her glucose control during her pregnancy.
Well, in my previous pregnancy, I was using a combination of finger pricking and Freestyle Libre. So for this, having the alarm function just on the Dexcom alone is quite life-changing because I don't have to worry so much about having significant hypos. But also when my blood sugars rise, even if I had no awareness of it, if I was sleeping through it, then I wake up always on a perfect blood sugar level, no matter what happens. The algorithm just kicks in and takes care of it. And also I feel more in tune with what's going on with my body and more educated.
And I think that's been one of the real things we've noticed, the feedback that actually just the importance of waking up with a blood sugar that's already on target, rather than having to spend half of your morning catching up.
Starting the day right makes such a difference, and I feel like I spent a lot of my awake hours and asleep hours worrying about my diabetes when I wasn't pregnant, but then again when you're pregnant you've got to worry about the baby as well. It's quite a high stress situation, whereas this, I'm still thinking about it and I'm still informed, but I'm somewhat on autopilot and it just reduces my stress levels so much.
And really that's our hope for all pregnant women, that they can be a little bit more on autopilot with their diabetes and enjoying a healthy pregnancy and delivering safe, healthy babies. Where we're up to now is we're I think getting the real world evidence that the closed-loop artificial pancreas can achieve tighter glucose levels than any of the individual components by themselves. So we're up to the larger scale, what we call the phase 3 or the clinical effectiveness trials. The next phase, of course, is going to involve health economics and regulators and getting these devices approved for real-world use by people with diabetes. So what I think we're going to see over the next 5 to 10 years will be a wider variety of different sorts of closed loop artificial pancreas systems. Hopefully we will see pumps a whole range of pumps that are insulin pumps that are compatible with the artificial pancreas. We'll start to see smaller, even more accurate continuous glucose monitoring systems. Already we see the control algorithms are used on a smartphone. People can access their glucose data on a smart watch. So the devices are becoming less intrusive, more user-friendly, easier to incorporate into normal daily living. But of course the question everyone wants to ask is, are these a cure? And the honest answer is that probably don't necessarily represent a cure. They represent fantastic technological progress towards a cure. We think of it like the bridge to a cure. So in the meantime, the artificial pancreas is certainly the best technological solution we have that's likely to help the largest number of people achieve the target glucose levels that they need to reduce their risk of complications.